Good afternoon, Mr. Mercer. Dr. White, I'll be taking care of you during your hospital stay.
Thank you very much.
Okay, I see your doctor's been treating your heart condition and diabetes for about 5 years now. How are you doing on the medications prescribed? Any problem?
No, I'm doing great. I mean, I'll probably get a little dizzy twice a week, and every now and then I'll have a bad headache, but my wife thinks it's because of the meds.
Okay. So let's review all the medications you're currently taking.
Yes, ma'am. I take 1 tablet of lisinopril a day, 2 pills of metformin, I think it's like 500 milligrams, and 16 units of Lantus SoloStar insulin. It's the pin thing.
All right, anything else?
No, that's it.
Looks like our patient forgot to tell his doctor about a lot of his medications. When it comes to preventing medication errors, there's a lot that patients just don't know. It's up to you to educate them on medication safety in the first time you act as their caregiver. To help prevent medication errors, here are some challenges you should be aware of. These are challenges that patients face in medication management. What patients want you to know. Patients often don't understand medical jargon. Use plain language to explain instructions. Also, explain any treatments or procedures before you begin. Patients don't always hear instructions accurately or even remember them. Ask the patient the best way for them to remember your instructions after they've left your facility. Sometimes patients like to receive a piece of paper and a pencil to write down what you say so they can remember what you told them. Others may want the instructions recorded for them because they may not be able to write them down themselves. Patients don't always understand rationale or reasons behind instructions. Patients are leery to follow medication decisions when they feel they have no input. Some patients prefer alternative treatment options. Patients have heard horror stories related to their condition and related medications and are afraid to take the medications. Doctors can improve proper medication management by respecting the patient in his/her wishes as much as possible, engaging in clear communication, leaving time for questions, educating patients about medication types and proper dosages, customizing care, taking into consideration the patient's personal needs, age, and lifestyle, coordinating care throughout the course of treatment, guiding principles for designing a successful medication reconciliation process. Develop a single medication list shared by everyone for documenting the patient's current medications. Clearly define roles and responsibilities for all staff involved in medication reconciliation. Develop effective prompts or reminders for consistent behavior. Educate patients and their families or caregivers on medication management and the important role they play in the process. Ensure process design meets all pertinent local laws or regulatory requirements. This concludes Module 3, Preventing Medication Errors in the Patient's Perspective series of Safety and Care. While this short module is informative, it is not comprehensive and does not address medication error prevention in its entirety. Patient advocates contributed to the dialogue, highlighting the key takeaways that patients want you as a caregiver to know, as they thank you for practicing safe and compassionate care going forward.